and welcome. I'm Mark Lynn, and this is a special program, COVID-19, Facts versus Myths. Now, over the next 30 minutes, we'll be taking questions from you on the situation arising out of the prevailing coronavirus pandemic so that you get accurate information for combating the coronavirus outbreak. To answer your queries, I have two guests in the studio. They'll be busting the myths about coronavirus, and they'll also be giving you facts so that you know what it is to take precautions and be safe without panicking and also falling prey to the rumor mill. So our telephone lines are open, and the numbers on which you can call us are now on the screens. So these are the numbers: 011-2309-7663, 011-2338-6682. They are on your screens, and also 011-2309-7620. But you must turn down the sound on your television sets while you make this call to prevent an echo and feedback sound from coming in. Now, I repeat those phone numbers for you. They are on your screens: 011-2309-7663, 011-2338-6682, and also 011-2309-7620. 011 is the code of Delhi. And in case you happen to be living outside India, then you have to prefix +91 or dial 0091 to these numbers. So let's begin with our discussion. We have with us in the studio Dr. Naresh Gupta, medical consultant of the Maulana Azad Medical College. And we also have Dr. Aparna Agarwal, who is Director and Professor of Medicine at Lady Hardinge Medical College. We'll start with you, Dr. Gupta. One question has already come through, and my producer has asked me, from one of the callers in. They've asked what if a person has been cured of coronavirus, is that an immunity for how long? Does he get, can they fall prey to the virus once again?
See, that's a very interesting question, because the coronavirus is somewhat different from the other viruses like the influenza virus, and so one would imagine that since it does not change its mutation so frequently as the influenza, one would get a longer immunity once you get the infection. The problem is the strain that has brought in COVID-19 is a different one, and we are not certain whether it will give rise to a lifelong immunity. My guess is, and this is based on the scientific evidence, that it would definitely give rise to short-term immunity. That means somebody who has COVID-19 now shall not get it again, but it may not be protecting him lifelong against a coronavirus.
Okay, so that's not protecting you lifelong. That's the answer. I hope the person who has asked this question has been watching the show and is satisfied with that answer. We'll turn to Dr. Aparna Agarwal. There's another question, Dr. Agarwal. People have been washing their hands regularly, and basically their hands are cracking, with excessive washing. So what do they do with that?
They can use any cream, moisturizer, simple oil after washing the hands to take care of that, because we need a little moisturizer. Frequent washing can lead on to dry skin and cracking of the skin.
Okay, we have a caller now who's joining us. Parmar is joining us from Rajkot. Parmar, ask your question, please.
Yes, my question is that I am working in bank, so we get to contact a lot of people. So what should we take precautions?
Okay, Dr. Gupta, he works in a bank and he meets lots of people. He also must be, touching lots of notes and stuff like that. So those are concerns.
Very true.
Yes.
I mean, it's good that the banks also have come out with these advisories that in the current technology environment, the customers need not visit the banks, which is a good one, and the citizens must follow it. The problem comes when there is a worker there. What does he do? There are few things that they should do. I think most of the banks have started keeping these sanitizers in their banks itself. They must use of the sanitizer, and even if sanitizer is not there, a healthy individual can just simply wash the hands frequently. And the reason for washing the hands frequently is because he'll be touching something, whether it is banknotes or it is the desk or it is somebody's bag, or so that gets washed out. So if he keeps doing that and he is healthy, there should be no risk. The the thing that he should be vigilant about is, in case he himself develops any respiratory symptoms, upper is common cold symptoms, he should refrain from going to the bank, number one. And he should not pass on that infection, whether it is coronavirus or another virus is immaterial. He should not pass it on, because right now we cannot distinguish coronavirus infection from other 100 viral infections that cause common cold.
Okay.
The other thing that they should do is, if any of the customers is also having a cold or fever, they can display it on their, they can have these charts in the banks. That person, that customer should also prevent its spread into the other customers and into the bank employees, and he can even be provided with a mask.
Yes.
So, few masks being kept there may not be a bad idea. Of course, he will be advised that you go home and you can do it online, but in case he has come up there, that person also. So, it's two-way transmission, and I think creating awareness through banks where there is a moving population of customers will also be a good idea.
Dr. Aparna, another question that's related to this is that people who do come to banks, and if they do have, coughs or symptoms, what should they be doing? I mean, first of all, they shouldn't be coming to the bank in the first place. But if they are there, then Dr. Gupta says that they at least should be providing with a mask. But if there are no masks around, then what should they do?
Actually, they should not be going out of the house without a mask. It may be a simple cold, but they should not be going out of the house without a simple mask, without the usual surgical or medical mask that we call. So, that discipline we have to bring in ourselves. That is extremely important now. For the coming few weeks, we have to bring in this discipline, and we must avoid touching our eyes, nose and throat when we are in such places where we are working and handling different things. If we avoid touching our eyes, nose and throat, mouth, I think that will also go a long way in helping this. We can disinfect the surfaces every 1 hour, 1.5 hours, and clean our hands regularly.
We are joined by Sivan, who is joining us from Delhi. Well, Sivan, give us your question. Yes.
Yeah. Actually, I have a question that if we are using if we are using public places like park and all for morning walk,
Yes.
whether it is advisable to go for morning walk, or should we refrain from going if you are a healthy person and not having any symptoms of any sort of viral infections and all?
An important question there, Dr. Gupta, because lots of people do take morning walks, and it's part of their routine, and it's part of their system in a sense, and it's good for their health. Should they be stopping that for these few days?
That I think is really a dilemma in the minds of many of the persons. It is a good activity, there is no doubt about it. But then one would also notice that most of the walks take place in the morning hours, and there is a collective walk. One does not tend to walk alone. There is a group that goes out, and then there are many more groups. So, under those circumstances, this healthful activity also can become a little more unsafe, and especially in the times when there is a corona outbreak, which we don't know.
Okay.
Remember that in corona, the fear now is not from the transmission of the virus from the symptomatic to the rest of the community.
Yes.
The fear is those who do not have the symptoms as yet, they can also transmit.
Okay.
So, I think it may not be very safe for the coming days to go for this walk, but I would still tell them that not walking does not mean that you just become a couch potato.
Yes.
You can do the yogas at home. You can do the walking drills. So, there are these small exercises you do for 10 minutes at home, and they are as effective. So, do something, but don't give up. Avoid going to parks which are very crowded or places which are having a lot of people.
Dr. Agarwal, attached to this question is that those people who have to take exercise, I mean diabetics and people like that who require it on a daily basis on prescription, what should they be doing at a time like this? I mean, they are used to walking like 4 and 5 kilometers a day. What are they going to do?
Actually, for diabetics, hypertensives, for patients with chronic illnesses, it is advisable right now, especially if you are elderly, to stay at home. So, that is the advisory which is given. If you have to take a walk, better to take it at times when it is less crowded, and maintain a social distance of at least 1 meter from the other walkers.
Okay.
If you have to do it, but better to do it at home, and as I said, elderly, diabetics with comorbid illnesses, better to stay indoors. It's a matter of a few weeks only. And we can do some exercises at home, as
Right.
Dr. Gupta has just told you.
Okay. We're getting another call in from Sangram. Sangram is calling in from Delhi. Sangram, tell us your question, please. Ask your question.
That also can be infected, right? So should we stop getting home deliveries?
Sangram, can you repeat your question, please?
We get a lot of food as home delivery,
Yes.
but the home delivery containers and other stuffs, that also, that also need to be,
Fair enough.
that also need to be,
Yes.
protected, because that can be contaminated.
Okay. So this is an important question, Dr. Gupta. The point is that people, quite a few people depend on food apps nowadays. That's the way we live. And you can't suddenly stop it because they don't have any other system. What do? Are these, is there any better system? How do you sort their dilemma out?
Oh, there may be better systems, but I think we have gone overboard when it comes to these deliveries,
Okay.
and especially these food items and others. You see, the food item deliveries that come through, it tends to give an impression that everything is going to get transmitted through those cartons or boxes or whatever they have touched. It's
Right.
not like that. Now, there are two things here. One is, even if you look at the coronavirus, it likes to stay in the body of some animal or human being. It largely stays in the body of animals,
Yeah.
and then sometimes it goes into the human beings. Now, it does not like to stay outside. So, if you leave the virus outside, it does not live for very many hours.
Right. 12
And-
hours max or something like that?
Yeah, in the
Okay.
air it doesn't even last for 3 hours, and it starts getting weaker actually.
Okay.
So, if you look at the boxes, cardboard boxes for example, that would be 4 hours. By the time it comes, it gets packed and it comes to you, is not that much of a, the time is already elapsed.
Okay.
And the other thing you can do is you can always clean it. But more important than that is coronavirus, when it came, the impression was that it comes from the transmission of these contacts. And the reason was the same coronavirus had come in a big way in 2002 and 3 when it was called SARS-1,
Okay.
severe acute respiratory syndrome.
Yes.
Now that was called SARS-1, this one is called SARS-2 because it is the same virus.
Similar, yes. Okay. Yeah.
But what has come out in the last couple
Yes.
of weeks in the research
Yes.
is that its transmission is
Okay.
different. Its transmission is more like flu or
Sure.
influenza,
Okay.
which means it's more like droplet. So
Alright.
you would be saving yourself from the droplet infections, but maintaining a good hygiene on whatever
Okay.
boxes or packets are delivered to you
Right.
is another good idea.
Right, we have another caller. Could you reveal your name once again, please? Ramesh. Ramesh is calling from Telangana. Ramesh, go ahead.
I
Yes.
am working in Singareni coal mines.
Yeah, go ahead, Ramesh. Yes.
Yeah. Because I'm an engineer. I'm working in Singareni coal mines.
Okay, coal mines, yes.
What I want to clarify is actually I will be exposed to so many persons coming from to my store's office from so many outside places. So that means I will be receiving material through lorries, transport departments. So they will be bringing documents for me, and I have to sign on those documents, and again
Right.
sending to my workmen for further process. So I will be at the risk of exposing to if any of those persons coming from outside are actually infected. So how we can control it? What
Absolutely. We
measures I have to take?
We get your question, Dr. Aparna Agarwal. How would you like to answer that? Because he, he, first of all, in the coal mines, he constantly meets people. He has to sign documents. He touches things. He has a problem on hand.
You have to avoid touching your eyes, nose and throat, mouth. So whenever you sign on a document, it is better to keep washing your hands in between. You can use a sanitizer at regular intervals, and whenever you're working, do not touch your eyes, nose or mouth. This
Okay.
virus can go inside through these routes. It does not
Yes.
pierce the skin and go inside. So you can always take these precautions while you are doing your work.
Right. We have another caller, so let's keep the calls coming in. But you want to say something to Ramesh? Okay, go ahead. Yeah, go ahead.
I just want to add something now that it has come up.
Yeah.
Coal mine itself also is a risk for some of the diseases.
Okay.
So we call them occupational diseases, and there are certain diseases which are called occupational lung diseases,
Yes.
one of which is this. So one should take preventive measures of other occupational diseases which can affect lung, because
Okay.
the combination of two would be very bad.
Very bad.
and it gets extreme if we get persons like who are smokers.
Okay.
So if they are smokers and their lungs are damaged because of smoking, if they contract coronavirus, it's going to be much worse. So don't compound your risk by smoking or drinking or occupational health.
Let's listen to what Amit has to ask us from Delhi. Amit, you're on the phone line. Give us your question.
Hello, sir. Thank you. Thank you.
Yes, Amit, go ahead.
Hello, sir. Good evening, sir.
Good evening.
Sir, which type of mask wear public place?
Which type of mask?
Should be masks wear in public place or not?
Okay. Dr. Aparna Agarwal, you can answer this question about the masks. I mean, we have talked about it several times on our channel, but it's an important question because lots of people are buying masks, they're trying to wear it. He's asking which type of mask one should have, but I think the advisory says
the does not need a mask.
Go ahead, ma'am.
And a simple mask is good enough for people with any respiratory symptoms, that is coughing or sneezing. If you have that, you need to wear a mask to avoid other people from getting infected by you. So that is the importance of mask, unless you are a health worker. For health workers, yes, you need to use a mask while in hospital, and simple masks are good enough, except for people who are coming in close contact with these patients. So doctors or healthcare personnel who are coming in close contact with secretions of these patients need to put on higher grade masks. Right. The other thing is only persons who are taking care of positive patients need to wear masks.
Indeed. Rajkumar is also on the phone line. Rajkumar, you can ask us your question now. Rajkumar is from Faridabad. Rajkumar, are you on the phone line with us?
Yes, sir. Yes, sir.
Yes, please ask your question, Rajkumar.
So my question is, can this be transmitted through mosquito or flies as other disease, mosquito, malaria and all, dengue like this?
Okay. Dr. Gupta, you can answer that, yes.
Rajkumar, it does not get transmitted through mosquito bites, it does not get transmitted through dog bites, it does not get through cat bites or any animal bite. It has a transmission which we call a droplet transmission, by which we are meaning that if somebody coughs or sneezing, then these viruses come out, and they might get deposited on the items, the tables and the other things that are around you, and from there one can pick it up, bring it onto the face or the eyes or nose, and it can get in. That's the only way it gets transmitted, and not through any mosquitoes.
Yeah, but that's a pretty easy way for it to be transmitted as well. That's why we have to take all the precautions. Dr. Agarwal, talking about the transmission of this virus, I mean, one is surprised how quickly it has spread across the world, isn't it?
Yes.
I mean, a virus doesn't have legs and hands and stuff like that, and doesn't move around. It's just transmitted through this method, and it's basically gone right across the world.
Yes.
How did this exactly happen?
This virus is actually very contagious, more than the usual flu virus or the SARS-1 that we had earlier. So it is very contagious. So one person with this virus can spread it around to 2.6 people on an average. So that is the reason why it has spread. The other thing being that travel has become so common these days.
Okay.
We are traveling from one place to the other nearly daily. I think there are many people traveling from one place to the other. So that is how it has actually spread and taken up this pandemic proportions.
Yes, Swati now joins us from Kanpur. Swati, tell us what you want to know.
I wanted to ask, how can we differentiate between a flu and this virus?
Okay.
Because this season is, people suffer from flu also. That is very common, change
Absolutely.
of season. People suffer from flu. So how do we really differentiate between, and do we need to panic? Because children which are at home are usually coughing, sneezing, So how do we really differentiate?
Dr. Gupta, this is an important question because at the current time, people who are in quarantine and they develop these symptoms only, they are being asked to go and test. But, that's because we are still in stage 2. But, I mean, we have to be prepared for the worst. In case we do reach stage 3, then everyone who gets into these symptoms will want to be tested, isn't it?
That's true. I am happy that Swati has asked this question. You see, let me tell Swati a little bit of a story, a short one. 60 years back, we had these colds and we wanted to know what viruses were causing it. We identified all of them, but we could not account for about 20% of the colds as to where they were coming from. and that's how coronavirus was discovered, that it is accounting for it. So right now also, apart from the other viruses, whether it is influenza or it is myxovirus, paramyxovirus or respiratory syncytial virus, there are so many. This also is part of the illness, and the two illnesses largely cannot be differentiated on clinical grounds, not in home anyway.
Okay.
Because they all cause fever, they all cause cough, they might cause some bad throat, and then they can go into lungs, which is more true of the coronavirus, but it is also true of the influenza virus, which she has raised. So the precautions that one takes, good cough or sneezing etiquettes, no spitting, no coughing around, safeguarding others by using a mask, not maintaining social distancing, they are all very good. But at the same time, it's equally important to remember that coronavirus of the 2020 SARS-2 will come and go. Those other viruses also have stayed on year after year.
Okay.
And many of those viruses have actually got preventive vaccines. Don't forget to take those vaccines.
Okay.
In fact, the influenza that she said,
Okay.
influenza has got a vaccine which is so effective and available for such long times. That's very good.
Fair
For
enough.
children, there are other vaccines also. For adults, there is a pneumococcal vaccine, which is for the pneumococcus, Haemophilus vaccine, mumps vaccines, measles vaccines, which complicates into pneumonia. So there are many. And as I said, don't complicate your illness by making your lungs weaker by smoking.
Let's listen to what Vivek has to ask us. Vivek is calling in, Vivek Shah from Ahmedabad. Vivek, give us your question.
Sir, I have a big factory, so many workers is there. So I make a sanitizer, combination of IPA and glycerin. Is it okay for sanitize the workers' hands?
Okay, you are using this sanitizer for your workers, or are you manufacturing it? What are you saying?
No. We are using.
Okay, you're using it. Okay, fair enough. Dr. Agarwal, so he's using a sanitizer with IPH and glycerine. Is that good enough?
IPH, I'm not sure.
What is IPH? Did you say IPH?
IPH, that is isopropyl alcohol and glycerin.
Okay.
70% alcohol is good. So in fact, we can make sanitizers at home using alcohol. So it should be 70%. So 70% alcohol with glycerin can be used for sanitization.
Okay,
thank you.
So that's, I mean, people are now even trying to talk about the kind of sanitizer that they're using, Dr. Gupta, but I mean, that could also be, I mean, coming back to the question I raised earlier, I mean, are sanitizers causing problems to people's hands, or should washing is causing a problem to the hands? Because, I mean, after a few days of doing this excessive washing, people's hands are cracking.
Yes, you're right, actually. So what happens in the sanitizer, it is basically the alcohol. And the alcohol, what it does goes and denatures the covering of these viruses. Now for that you need minimum of 60%, and that is why Aparna said 70 is safe. The problem with the alcohol is the moment you keep increasing the percentage, like one can get 100% alcohol and one can use it. The problem with those percentages as they go up is they evaporate very fast. And once they evaporate very fast, they leave dryness. One of the reasons why he and others had glycerine. So one has to be careful that excessive use or excessive strength could lead to more dryness of the hands.
Okay. Now let's understand about social distancing itself, Dr. Agarwal, because tomorrow the Pradhan Mantri's call, for a Janta curfew, and that's an important measure. What are we going to achieve by this, medically? Because what we are trying to do is break the chain, isn't it, of transmission by people staying at home, and why and how important is that for them to stay at home? Could you tell us?
That will basically lead to social distancing, what we have been harping on, I think, from the beginning. So people will not be going out to meet people, others will not be coming in. So we have to stop the virus. So spreading the virus or inviting the virus, both the things will reduce. We will not be touching things which are touched by multiple people at the time, like doorknobs, handrails, seats, metros. Whenever we are going, when we are going to different shops, we touch the door handles, the slabs where we are keeping different things. So all
Okay.
these things will be prevented. That's how
Okay.
it will help.
We have a last caller, so let's listen to Nishagra as the last caller. Please give us your question.
Hello, Dr. Agarwal. And my question is,
Yes, Nishagra, we can't seem to hear you. Could you please repeat your question?
hello, my question is
Yes.
to Dr. Agarwal that I have recently traveled from Chennai,
Okay.
and I had my luggage with me, and now I want to know what kinds of disinfectants should be used to.
Okay.
Simple household disinfectants are good enough.
Household disinfectants are good enough.
Yes, for all these luggage things, simple household disinfectants are good enough.
Okay.
Okay.
You can also use a sanitizer, but simple
Uh-huh.
household disinfectants are good enough.
And
for
how
cleaning.
long will it survive on the
Surface of inanimate objects, yes.
Yes, yes.
We don't exactly know, possibly a few hours to
Okay.
about 12 hours, but it
Okay.
can be a few days. We don't know that exactly.
Okay.
Okay, okay, okay.
A final word from you, Dr. Gupta, and then we'll conclude this program. So, what would you like to? What final advice would you like to give people after listening to the kind of calls that have been coming in?
You see, I would like to tell them that tomorrow on Sunday, when they are at home, they should introspect. For the past 20 years, we had more than half a dozen outbreaks like these epidemics and pandemics that came from the viruses. Why are they attacking us in such bad manner now?
Okay.
And I just came to know that some of the places which were drowning, Venice was drowning, now you see these geese and birds and
yeah.
dolphins, they are coming back. And one tends to feel that there is climate
Okay.
change and the environmental deterioration that we have created,
Right.
that leads to create
Yes.
a balance. Just introspect
Okay.
that everybody should live in harmony.
A final word from you, Dr. Agarwal.
We have to be careful, informed, and responsible citizens. We have to work together as responsible citizens, maintain hand hygiene, maintain respiratory hygiene, and cough etiquettes. That's the only message I will give, and we can fight it together if we do all this.
So
Thank
we are on. So the advice of our doctors here in the studio is to introspect and also to be responsible citizens, and hopefully that's really the message that all of us need to take home with us and stay at home actually with us, because tomorrow is that important day, the Janta curfew, and it is at the end of the day, it is the onus is with us. We are the carriers of this virus. If we actually take good care of ourselves, we can stop the virus from spreading, and that will do wonders to everything, even the entire economy, which is another discussion that one should have sometime. Thanks very much for being with us. Namaskar.